How to minimize needle biopsy risks for lung cancer. When doctors need to find out if a lung nodule is cancerous, they often use a needle biopsy. It's a minimally invasive way to get a small tissue sample from the lung for testing. While generally safe, it's important to understand how to reduce the chances of complications. Knowing what to do before, during, and after the procedure can make a big difference in safety and comfort. One of the main risks of a needle biopsy is pneumothorax, which happens when air leaks into the space between the lung and chest wall. This can cause the lung to partially or fully collapse. To lower this risk, healthcare providers carefully evaluate your medical history and imaging scans beforehand. If you have lung conditions like chronic obstructive pulmonary disease or blood clotting issues, your doctor might suggest alternative approaches or take extra precautions. It's also important to inform your team about any blood thinners or medications that could increase bleeding. During the procedure, using imaging guidance such as computed tomography scans or ultrasound helps doctors precisely target the lesion. This reduces the need for multiple needle passes, which can increase the chance of complications. Skilled operators with experience in lung biopsies are essential, as they know how to perform the procedure safely and efficiently. Limiting the number of times the needle is inserted and choosing the right needle size and type for your specific lesion can also help minimize risks. After the biopsy, close monitoring is key. Patients are observed for signs of trouble, such as difficulty breathing, chest pain, or coughing up blood. A follow-up chest X-ray is often done to check for pneumothorax. If a small pneumothorax is detected, it might resolve on its own, but larger or symptomatic cases may need a chest tube to remove excess air. Positioning the patient so they lie on the side of the biopsy immediately afterward can sometimes help reduce the severity of pneumothorax. Managing any complications quickly is crucial. Most issues are mild and can be treated easily. For example, a pneumothorax might just need oxygen or a small chest tube, while bleeding is rare but may require medical intervention. Serious complications like air embolism or tumor seeding are very uncommon but requiring immediate attention if they occur. Balancing the benefits of accurate diagnosis with the small risks involved is important. The information gained from a biopsy often guides treatment decisions and can be life-saving. Every patient's situation is different, so your healthcare team will tailor the approach to your health status and needs. Always ask questions about the procedure, understand the risks, and follow your doctor's instructions carefully. If you experience severe symptoms after the biopsy, such as intense pain or trouble breathing, contact your healthcare provider right away. In the end, minimizing risks during a lung needle biopsy involves careful planning, skilled technique, and attentive care afterward. While no medical procedure is completely without risk, most complications are manageable and rare. Remember, always discuss your individual case with your doctor to make the best decision for your lung health. Your safety and peace of mind come first, and working closely with your medical team is the best way to ensure a safe and effective diagnosis.